Good morning. Today is Sunday, March 21st, 2021, and I'm Margaret Drugovich, the president of Hartwick College. What a weekend. Even the most stubborn piles of leftover snow are gone now. 50 degrees yesterday, 60 degrees today, 60 throughout the coming week. Please be sure to get outside. Well, our entire community was able to breathe a sigh of relief this week with the opening of a state vaccination site in Oneonta. After 2 months of long drives to Syracuse and Albany and Binghamton and Plattsburgh, a center opened this week on the SUNY campus. And at least 8 more centers opened this week across the state, stretching from Niagara Falls to New Paltz to Southampton. If you're eligible and you're looking for a vaccination, or if you're not sure whether you're eligible, just Google "Am I Eligible New York?" and you can see where vaccination appointments are available and walk through some qualifying questions. The state site has improved. Information on it is now more readily available on which vaccine is given at each site, and in general, I think appointments are more available. Now, you still have to qualify for eligibility before getting a shot. Like everything else about COVID, the rules around eligibility continue to shift. For employees who sought permission to and are now working remotely, we have received clarification from the State Department of Health about your possible eligibility for the vaccine. At this time, you remain ineligible for vaccination if you plan to continue to work remotely, unless, of course, you meet some other age or comorbidity qualification. However, you can now be considered eligible for vaccination as an essential in-person staff if, upon receiving the vaccination, you return to in-person work on our campus. So here's what you should do. Please talk to your supervisor or vice president about your work arrangements and see if this possible eligibility could apply to you. And what about vaccination eligibility for our students? Well, some of our students, those with special health conditions, student teachers, those with clinical responsibilities, for example, they have been eligible for the vaccine. But we received guidance this week that students who are employed on our campus with student-facing roles are now also eligible for vaccination. However, that still leaves a large number of our students ineligible for vaccine at this time. So what do we think we can expect regarding student vaccinations? Well, President Biden now has directed states, tribes, and territories to make all adults eligible for the COVID-19 vaccine no later than May 1st. He's taken this step because the government expects that by the end of May, there will be enough vaccine supply to vaccinate all adults in America. This means that our students should be able to get their vaccination before they return to campus in late August. So we can see the path forward, and that path is paved by vaccination. This is very good news. If enough of our students and employees get the vaccine, if enough of America gets the vaccine, the way we operate in the fall will more resemble what we all might hope for. However, we're not done with COVID-19 just yet. There's still so much to be learned. For example, we need to learn whether the antibodies that develop in response to the COVID-19 infection actually protect us from further disease. We need to see how long post-vaccine or post-infection immunity actually lasts. Studies need to be done to determine how easy it is for vaccinated people to spread COVID-19 to others. And time will tell how effective the vaccine is at protecting people from contracting a variant of the original COVID-19 infection. We now know that a variant called B.1.526, first detected in New York City, now accounts for up to 50% of all cases in New York State. Now, this mutation may be less susceptible to immunity prompted by the vaccines than was the original form of the virus. It may also be more transmissible. All of this is knowable and will likely be known in time. What we do know now is that the less COVID spreads, the less likely these mutations are, And the more people who are vaccinated, the less likely it is to spread. So for now, I ask that you please take note of this refreshed guidance from the CDC regarding vaccination. You aren't fully vaccinated until at least 2 weeks after your final shot. Once you are fully vaccinated, you should still watch out for symptoms of COVID-19, especially if you've been around someone who is sick. If you have symptoms of COVID-19, even if you've been vaccinated, you should get tested and stay home and away from others. Even if you are fully vaccinated, you should continue these steps to protect yourself and others in many situations. Wear a mask, stay at least 6 feet apart from others, and avoid medium and large-sized gatherings and poorly ventilated spaces. And finally, and I know this is a disappointment for those of you who are eager to get out and about, but the CDC also continues to recommend that you delay domestic and international travel for now, even after vaccination. And for students and employees, please don't forget, send the Perella Health Center information about your vaccination. Knowing this information will help us to support you in the event of your possible exposure to COVID-19 or in the event of other changes in state and federal guidance that might end up applying to you. The safety of our community remains our first concern. The strategic response team is discussing all that we learn as we learn it to assure that we're responding appropriately to new information. All the rules that are currently in place will stay in place until we decide that it is time to revise them. At Hartwick, we're going to continue to follow the science and the public health guidance. And by the way, yes, campus remains closed to the public for now. It was another relatively good week on our campus with regard to new COVID infections. Our campus community is working really hard to control the spread of COVID, and I thank you all for that. We administered 1,159 COVID tests this week with only 2 new positive student cases and no new employees from our testing. The total active case count is now down to 6, including 5 students and 1 employee. Based upon our contact tracing, we continue to see that close contact is still the primary conduit to a COVID infection. Now, make no mistake, these infections, even in their now small numbers, are disruptive. Though many activities related to work and study can continue for those who are in quarantine and isolation, some are simply not possible. Unfortunately, when it comes to public health, there's a limit to what the college can do to intervene on behalf of our students. For example, athletes have had team activity disrupted by positive cases in quarantine. Nursing students have had key external clinical experiences interrupted by infections and quarantine because our clinical partners must protect their own patients. These steps are necessary in the name of public health, and the consequences of an infection are actually subject to the direction of various partnering authorities. The college will continue to do all we can to support and advocate for our students and employees, given the considerable impacts of this public health emergency. On Friday, the number of new U.S. cases of COVID rose day over day by 66,000. Over 8,000 of these new cases were reported in New York State. Germany, France, and Poland are considering a new round of lockdowns. We're not yet out of the woods. Our top priority is the well-being of all of our students and employees, and this priority will guide our decision-making until COVID is in the rear-view mirror. COVID has reminded me many times over the past year that the nature of our community is shaped by our individual actions. Kindness, caring, acting in ways that nurture and protect These things make us stronger. On Friday, I sent a message to our community that reaffirms that there will be no room at Hartwick for the bias-fueled violence toward Asian Pacific Islanders that we have witnessed across the U.S. in this past year. Now, if you are not a member of the Asian Pacific Islander community, you may think that this violence is not your concern. Maybe you think that you don't know a victim of hate. Or if you have not been a victim of hate yourself, you may believe that this is someone else's problem to solve. Maybe you think this is a concern for the police or the government or for civil rights activists. But actually, this is a concern for you and for me. We all have a vested interest in protecting others from the violence of hate. Hatred causes deep personal harm, saps our collective energy, and deprives us of the personal growth that can only come with exposure to experiences of those who are unlike us. Hartwick prepares our students to meet the challenges of our interdependent world with understanding and acceptance. We should expect nothing less from one another. The first step toward accepting our share of responsibility to eliminate hate is for each of us to value and be open to the lived experience of others, no matter how different they may be from how we see ourselves. Through this knowing, we are changed. Today's song speaks to this openness. As the song goes, one conversation, a simple moment, the things that change us if we notice when we look up. Today's song is Underdog, as performed by Alicia Keys. Be safe. Please wear your doubled mask. Have a great Sunday.